Hi, I'm Anita, and this is Care Experts, brought to you by CareCredit. The CareCredit credit card can help you get the look you've always wanted now. CareCredit is accepted at hundreds of thousands of locations nationwide for things like cosmetic surgery, injectables, and other beauty procedures. Today, we're in Los Angeles, California with Dr. Faris Yamin. Dr. Yamin is a licensed plastic surgeon in Beverly Hills. Dr. Yamin specializes in rhinoplasty, facial aesthetics, and body procedures. So thank you, Dr. Yamin, so much for joining us today.
Thanks for having me.
So tell me about cellulite, okay? Now, I know how frustrating cellulite can be, and why is it so hard to lose through diet and exercise alone?
Excellent question. So cellulite is actually not a pathological process. It's part of the physiology of the skin and the subcutaneous tissue. It's thought to be caused by fibrous tissue that connects the skin down to the deeper fascia at the level of the muscle and the subcutaneous fat. So the problem is when these fat pockets around these fibrous tissue alternate and change, with weight gain and hormonal changes and gravity, cellulite tends to pucker and pull on the skin and give that irregular, kind of not smooth looking, and it's not very aesthetically pleasing on the surface of the skin. So the problem is it doesn't matter if you try to exercise or lose weight or even gain weight, these fibrous tissue will stay there and will keep pulling on that area of the skin. That's why losing them without any intervention, it's difficult.
So let's talk about some of the treatments for cellulite. So I know Cellfina is something that's popular. Can you just explain to me a little bit more about what that entails?
So the basic idea for Cellfina came from a procedure that we call a subcision, which basically going underneath the skin and using a sharp instrument, either a sharp needle or a knife, and release these fibrous bands to let the skin snap back up and go into level. So Cellfina, they basically modernized the approach, and they used an instrument that does cup suctioning that sucks the area of the skin that wants to be treated higher up, and using a sharp needle that goes underneath the skin and release them, and uses a local anesthetic in the area in order for it to be done, without any pain. However, the problem with these procedures, we are assuming that the human body is going to react 100% to the physics of what we're doing. But medicine is not an exact science, and human body is not going to respond to the physics of what you're trying to do exactly the same way you think it's going to do. So it's not necessarily when you release these fibrous bands, the skin is going to snap back to the level that you think it will be smoother and more aesthetically pleasing. And that's why it's still work in progress trying to manage cellulites.
Now, so to your point about your body reacting differently, how long would the treatment last, and would you need reoccurring treatments?
That's correct. So you need multiple treatments to achieve the result that you like, and that all depends on how large the surface area you're targeting, how many areas you're trying to achieve. Because if you do too much all at once, you're creating too much trauma, too much bruising, and the result will be very unpredictable. So yeah, it requires multiple sessions.
So now you mentioned bruising. So what are some of the side effects that someone could expect with Cellfina?
So the main side effect really is that you're not going to get the result that you were hoping for.
Okay.
But bruising and swelling is expected with any surgical procedure, and usually subsides very well within a week or two. But in the end of the day, that's why the patient has to be prepared to have multiple sessions, because you might think that you targeted all the areas, but then other areas will show up as these fibrous band release and other ones becomes tighter.
Thank you, Dr. Yamin. We'll be back with more Care Experts after this brief message.
Thanks to CareCredit, I can take care of my best friend.
Thanks to CareCredit, I can smile again.
Thanks to CareCredit, I can be confident.
Thanks to CareCredit, I can prepare for veterinary care.
I can take care of myself again.
I can be myself again.
I can plan for Cooper's care.
I can take care of my pug family.
I can.
I can.
I can.
I can have peace of mind.
Welcome back to Care Experts. So let's continue our discussion on cellulite. So besides Cellfina, what are some other cellulite treatments?
So the old school treatment, which is subcision, the basic treatment that Salfina based on, which is the same thing. You're numbing the area and you're targeting them with a needle that you're going underneath the skin, trying to release these bands. Recently, they added a new approach. It's an injection medication called collagenase. It actually came from hand surgery when we used to manage Dupuytren contracture, or we still manage Dupuytren contracture, which is also fibrous thickened bands in the hand that limit movements of the finger. We injected with that enzyme. That enzyme goes underneath the skin and attacks these fibrous tissues, so attacks the collagen molecules inside the fibrous tissue and release them. So they took the idea, same thing from the hands, and we apply for cellulite since it's also fibrous tissue, since it also has collagen molecules inside of it, and we use that enzyme, collagenase, and we inject it also in the areas of the cellulite. But again, the result is not always 100% because you don't know how the enzyme is going to react. You don't know how the fibrous band is going to react. Some of them might release, some of them are not. So also the patient is going to have to be prepared to have multiple sessions in order to achieve that final result. All these approaches are non-surgical, if you will, and can be done under local anesthetic. But there's an approach that you will need to go to the OR for it, which is a combination of liposuction and fat grafting, which is in that case, you are actually not only releasing the fibrous band, but you're also targeting the fat pockets. And it's not random liposuction or fat grafting that usually it's done. It's a strategic liposuction and fat grafting, meaning that you are targeting certain fat pockets that's creating the irregularity while enhancing other areas in the body that are either divided or they are in depression. So in order to achieve that smooth curvature or smooth area in the skin.
Are there various pros and cons, maybe, to some of these other more invasive procedures that you were mentioning?
Yeah, I mean, obviously the downtime will be longer. It's a longer commitment. You have to go to surgery, so you have to be under anesthesia. It involves much bigger procedure because you probably don't want to target only the area of the cellulite. You're probably targeting a larger surface area, a larger part of your body, meaning that involves either the abdomen, flanks, thighs, and buttocks area. So it's a bigger procedure, longer downtime and longer recovery from local procedures that are done without anesthesia.
Now, a question that everyone is probably very interested in. So how much would a cellulite procedure like this cost?
So if you are combining a surgical procedure where there's liposuction and fat grafting, you are definitely looking around 10 to 15,000 of financial commitment. Obviously, when you look at a local procedure like Salfina or using the collagenase injection, they are much lower price because your pricing point will be around 1,000 or 2,000 per session per treatment. But keep in mind, you're going to need multiple treatments.
Yeah, you don't know how many treatments you're going to need.
Exactly, so it might add up.
Well, thank you so much, Dr. Yamin, for joining us today and for all your wonderful information.
My pleasure.
Thanks for watching. All of our featured care experts accept and recommend the CareCredit credit card, which is accepted at hundreds of thousands of provider locations nationwide. Visit carecredit.com for more information.